This case is actually pretty cool. It's really a ptosis case. It's a very mild ptosis. You can see that her brows are elevated in the before video, and in the after, they have started to relax and come down. And her crease is actually a little bit lower, but it's better defined. So what did I do, technically speaking, in this surgery that was very specific to her Asian eyelid surgery and ptosis repair? So when I went in and I made an incision through her old incision, the ptosis that she had wasn't really from any prior surgeries, but I was looking for the levator tendon, not the muscle, and I'm advancing that. Again, I'm attaching that edge of the levator tendon to the tarsus with these vicryl sutures. In her particular case, I only advanced the tendon on either side about 2.5 millimeters. Now this gave a very subtle lift to her lids, and that allowed her brow to relax because her brain no longer is sensing a heavy eyelid that is obstructing her vision. Even though it wasn't really obstructing her vision, that heaviness, especially towards the end of the day in patients with very mild ptosis, still contributes to a tired look where they can't keep their eyes up and they're fighting to keep their brows up as well. So very, very subtle 2.5 millimeter levator advancement on her. Essentially no skin excision. Well, that's not true. There was about 4 millimeters of skin in total at the widest point removed. And then I closed it with anchoring technique as well to help make sure that her crease stayed in a very low position, because in her particular case with her anatomy and in keeping with her goals, wanting to look conservative and natural, she can't afford to have a crease that's higher than an anchoring point of, say, 5 millimeters, because in her that would look very unnatural and it would literally fight the ptosis repair that we did, because it would be too high on her eyelid and would hold the lid down when she tried to look up. So that's how that case was done. We can crop my eyeball out and put it over here. We can just take this part and move it over there.